I'm told that there are questions that have been posed, and I think we'll try to answer as part of our brief. Aviation is one of the high-risk sector, which enables high levels of mobility, and by extension, the spread of coronavirus. As this sector, we have put in place measures to mitigate the risk. Desktop exercise have been carried out across all our airports in accordance with the World Health Organization advisory to ensure that screening measures to limit the risk of exportation or importation of the disease are implemented without unnecessary restrictions to international traffic. Our agency at the airports, AXA, as you all know, has since procured, you will have seen at all the airports, and distributed masks for all frontline staff at all AXA airports. As an integral part in the airport operation value chain, the following are mandatory measures for the airlines and all handling agents. All airline or ground handling staff carrying out assisted passenger services, especially passengers with reduced mobility, are required to use personal protective equipment, which is referred to as surgical mask and gloves, when facilitating arriving international passengers. Passenger-facing personnel, particularly for all international arrivals, transfers, terminal, and the domestic recheck, are required to use surgical masks and gloves. All handling agent staff that are at high risk or contact, including but not limited to passenger escorting, VIP services, facilitation, ticket sales, baggage handling and loading, aircraft grooming, catering services, cargo handling agents, bus drivers and crew transport drivers are also required to wear surgical masks. All passenger buses will require additional cleaning, sanitization measures to be implemented, and AXA will increase oversight in this aspect. Yesterday, the President announced that we are imposing a travel ban on foreign internationals from high-risk countries such as Italy, Iran, Korea, Spain, Germany, the United States, the United Kingdom, and China as from the 18th of March, 2020. From a transport point of view, this means no foreign nationals will be allowed from these countries through our ports of entry, which include airports, seaports, and railways. Charter operators will be rerouted to international airports that have the port health capability to manage suspected cases. The following international airports have the necessary capacity and will be ready to handle charter flights: OR Tambo, Lanseria, Kinshasa, Upington, Polokwane, Bramfisher, Kruger, Mpumalanga International, Pilanesberg, Port Elizabeth, and Cape Town. The Civil Aviation Authority has issued guidelines for infection control for all airlines in respect to passenger cargo and baggage handling. This guided by the general guidelines of WHO. In order to mitigate the risk, the Civil Aviation Authority will conduct ramp inspections on all identified high-risk airlines. Your question about public transport, we will engage with everybody and issue instructions. Among others, in our space, we've got PRASA, which will undergo and perform sanitization in all our trains. Of course, the social distancing will affect us en masse in terms of trains and taxis. So that include education in relation to this, but over and above, random testing will be applied. in all the taxi ranks and also in the trains, but equally, taxis will also be expected to undergo sanitization across the country. We will engage with all, starting from today, and consolidate our plans that are already in place for implementation after the instruction by the President yesterday. Maritime, SAMSA will immediately operationalize an operational plan for all ships calling at port, and guided by also the International Maritime Organization and the World Health Organization. And you asked the question about will it be people and the cargo? The cargo will not, but people will be not be allowed to disembark. Cross-border transport, we are working with all other agencies in relation to this. Thank you very much.